You're watching Coronavirus in Context. I'm Dr. John Whyte, Chief Medical Officer at WebMD. Many of us are wearing sensors, trackers, and there's a lot of data that talks about maybe these wearables can tell us earlier on than testing if we have COVID. So to help answer some of these questions, I've asked Dr. Vincent Vercamer. He is the head of health and innovation at Withings, based in Paris, France. Bonjour, Dr. Vercamer. How are you today?
Thank you. Hello, John, and thank you for the invite.
Let's talk about the role of wearables, the role of sensors, trackers, patients collecting their own information. You've all been very big in blood pressure monitoring, but also temperature. What's the role of wearables in terms of detecting COVID earlier than perhaps someone may be developing symptoms or even testing?
The way of wearables, as we think or imagine at Withings, is that they are connected health objects that are clinically validated and that are used in real life, in everyday life of the users. That could be patient or maybe a future patient. And with this kind of data collection of their vitals in real life, then we are able to first observe and then in a second step predict some exacerbation or some changes in the basal state of someone who is healthy, and then few days after is not healthy anymore.
So what has your data been showing you? If I'm using some wearables, what should I be looking at?
So you can do it on yourself, and also you can try first to spot at trends. So if you have always the same night heart rate, then if you have an increase of this heart rate, then it might be a clue that you have some kind of disease or infection, or maybe you drank a bit much last night.
I did not, but and then you can use this data to help give some input. Now, with many of us not able to go to the doctor, there's really been an acceleration of what we're calling this DIY, this do-it-yourself approach to healthcare, not just telemedicine, but also trying to collect more data on ourselves and then looking at it. Is that what you see the future of healthcare? And I also want to ask you, make it a two-part question. Is it different in Europe in terms of how people are embracing these trends, wearables, do-it-yourself, than it is in the United States?
Yes. So it's different in Europe and in the United States. But for example, in the US, we had this partnership with the Boston Children's Hospital. So during the pandemic, at the beginning of the pandemic, we used our health bot, a chatbot, to push the coronavirus self-diagnostic questionnaire designed with the Boston Children's Hospital to US users. Then at the end of the questionnaires, they get some recommendation. Maybe you should call a doctor, maybe you should go to the hospital, or maybe you should just continuing monitoring yourself, but there is nothing that is alarming us at the moment. So that's a step in what you've mentioned.
What do you think is the future of wearables and sensors and trackers?
The future of wearables and sensors is to collect data in real life and outside the office of a doctor, where we spend a very short amount of time per year, while we are sleeping every night during around 8 hours in our beds. So we can collect real world and data and build some kind of diagnostics based on these trends that we can observe in total transparency of the everyday life.
So this is really how we're going to move into real world evidence as we talk about the use of data to influence clinical trials, drug development, as well as diagnostic management. It seems very much that you're talking about it, including physician and other health professionals in interpreting the data.
It's a way, for example, it's a way to detect underdiagnosed conditions such as sleep apnea or atrial fibrillation or other hypertension that you don't have any symptom. Mm-hmm. Sometimes you have headaches, but with connected health objects, then you can give objective data to the physician when you are going to the office for a checkup.
Tell us what devices you use.
So I use the ScanWatch, which is the last watch that we've launched this month. It's a watch with the SpO2 and saturation, oxygen saturation, and an ECG. One of my favorite device is the sleep analyzer, because you put it under the mattress and every morning you get up and you have your breathing rate, heart rate, and also your risk of sleep apnea. So
I put it under the mattress as opposed to wear it on my arm. Why under the mattress?
Yeah, because it's you don't need to charge it. You don't have to. So it's automatically synchronized the data using your Wi-Fi. So you don't even have to think, I need to use my device or I need to wear my watch. You just sleep and in the morning you get the data of your night.
Now tell us what's happening in Europe with COVID, particularly you're in France. We're seeing an increase in the number of cases. Tell us the latest in terms of how it's being managed in Europe and particularly in France.
So in Europe, we have several clinical trials that are running. Some were done in the APHP hospital, so it's one of the biggest group of public hospital in Paris. And we also recently launched a study with the LMU Clinicum, so it's the Munich hospital, one of the biggest hospital in Europe. They are doing a randomized control trial with 300 people that are COVID positive, and they just go home for usual standard of care, and the other 300 people get a ScanWatch for monitoring themselves, and they also have a phone number where they can call at any moment, and they get a physician from the hospital, and that's all. So we are trying to find what is the right moment for these people that are not, they don't need hospitalization. So, but the physicians and the doctors want to find the perfect moment for if they need hospitalization. So not too late and not too early.
Well, Vincent, I want to thank you for taking the time today to provide your insights about the role of wearables, how we use that data, in consultation, with our physicians, as well as how they're going to continue to have an impact in how we address kind of this DIY approach in healthcare. So thank you for taking the time today.
Thank you for the invitation.
And I want to thank our viewers for watching Coronavirus in Context. I'm Dr. John Whyte.